Have you ever woken up feeling fundamentally different? Not just tired, but with a subtle signal your body is sending, something you can't quite put your finger on, yet it persists morning after morning? What if those quiet morning messages, the ones easily dismissed, are actually early warnings of something serious, like cancer? I'm Dr. Robert Miller, and my work focuses on helping adults navigate their health journey, especially as they age. We often learn to ignore aches or changes, attributing them to getting older. But certain warning signs demand your attention. Ignoring them could mean delaying a diagnosis when treatment is most effective. Today, we're cutting through the noise to discuss 4 specific morning warning signs that medical professionals link to a potential underlying cancer. These aren't meant to cause panic, but to empower you with knowledge. Understanding these signs is the first critical step. Let's examine what your body might be telling you when you first wake up. Number 1. A persistent cough or hoarseness. First thing in the morning. Waking up and immediately needing to clear your throat or starting the day with a cough that just won't resolve isn't always benign. It's quite common for older adults to experience occasional throat clearing or a slight morning cough due to factors like drier mucous membranes, potential acid reflux overnight, or even side effects from common medications. However, the warning sign we're highlighting is distinctly different. We're talking about a cough that becomes a daily fixture for weeks on end, or a voice that remains consistently raspy or weak each morning, long after any cold or obvious irritation has passed. This persistent nature, especially when it represents a change from your usual health state, is what demands attention, moving beyond typical age-related quirks. For seniors, particularly those with a past history of smoking or exposure to lung irritants, a persistent cough warrants serious thought regarding lung cancer, as age is a primary risk factor. Don't dismiss a new cough or, critically, a change in a long-standing smoker's cough. If it sounds different, happens more often, or starts producing phlegm, especially with blood, see your doctor. Coughing might feel worse upon waking because secretions can pool in the airways overnight, triggering a stronger reflex when you start moving. A tumor might also irritate or partially obstruct airways, making breathing feel different after rest. Similarly, persistent hoarseness lasting more than 2 or 3 weeks is a cardinal early symptom of laryngeal, voice box cancer, which also sees increased risk with age. A tumor can directly affect vocal cord vibration. Also be aware if this hoarseness is coupled with a persistent sore throat, difficulty swallowing, ear pain, or a feeling of a lump in the throat, as these can indicate throat cancers. The crucial takeaway is not to automatically attribute these persistent morning symptoms solely to getting older or existing conditions like COPD without proper evaluation. If a new cough or hoarseness sticks around for more than 3 weeks, changes character, or is joined by other red flags like shortness of breath, chest pain, fatigue, or unexplained weight loss, it's essential to consult your physician promptly. Early investigation is key for better outcomes should a serious issue like cancer be the underlying cause. Second, profound morning fatigue that doesn't improve with rest. Feeling tired when you wake up occasionally is normal, but experiencing deep, unrelenting fatigue every morning, even after what should have been a full night's sleep, is a different matter entirely. This isn't just feeling groggy, it's an overwhelming exhaustion that makes starting the day feel like climbing a mountain. This type of debilitating fatigue, known clinically as cancer-related fatigue, is a common early symptom of several types of cancer. It differs significantly from regular tiredness because rest doesn't alleviate it. Your body is expending enormous amounts of energy dealing with the metabolic demands of cancer cells growing and dividing. Furthermore, cancer can trigger systemic inflammation, releasing substances called cytokines that disrupt sleep patterns and contribute directly to feelings of exhaustion and malaise, often most acutely felt upon waking when the body should feel restored. Blood cancers, like leukemia and lymphoma, are notorious for causing this profound morning fatigue. These cancers disrupt the production of healthy blood cells, often leading to anemia, a low red blood cell count. Fewer red blood cells mean less oxygen is delivered to your tissues, resulting in persistent, bone-deep weariness. However, Other cancers, including lung, colon, stomach, and liver cancer, can also cause significant fatigue due to inflammatory processes, nutrient absorption issues, or the sheer energy drain of the disease. If you consistently wake up feeling drained, weak, and utterly exhausted for several weeks despite adequate sleep, don't dismiss it as just getting older. Track this symptom, note any accompanying signs like dizziness, pale skin, or loss of appetite, and discuss it thoroughly with your physician. It could be one of the earliest signals your body sends. Before we continue to the next critical sign, let me speak directly to those of you watching who are over 60, or perhaps over 70. The health information we share on this channel is specifically curated with your unique needs and health considerations in mind. Understanding these subtle changes becomes increasingly important as we age. If you haven't already, I strongly urge you to subscribe to this channel right now. Click that subscribe button and ring the notification bell. Doing so ensures you won't miss vital health updates that could genuinely impact your well-being and longevity. Staying informed is one of the most powerful tools you have. Subscribe now so you don't miss out. Sign number 3. Waking up drenched in sweat without an obvious cause. Waking up in the middle of the night or early morning to find your pajamas and bedding soaked through with sweat, even when your bedroom isn't overly warm, can be alarming. While occasional night sweats can be caused by various factors like infections, medications, or hormonal changes, including menopause in women, persistent, drenching morning or night sweats are a recognized potential symptom of certain cancers. These aren't just mild perspiration. Cancer-related sweats are typically severe enough to require changing your sleepwear or sheets. They often occur regularly. Why does this happen? Certain cancers, particularly lymphomas, cancers of the lymphatic system, and leukemias, cancers of the blood and bone marrow, can trigger the immune system in a way that affects the body's internal thermostat, leading to fevers and excessive sweating as the body attempts to cool down. Carcinoid tumors and some other hormone-producing tumors can also cause flushing and sweating. The body's inflammatory response to the cancer itself can also play a significant role in disrupting normal temperature regulation. People might ignore these sweats initially, blaming anxiety, bedding, or room temperature. However, the defining characteristics of potentially concerning sweats are their intensity, drenching, frequency, occurring regularly over weeks, and lack of a clear external cause, like a hot room or too many blankets. If you experience persistent, unexplained, drenching sweats upon waking or during the night, especially if they are accompanied by other symptoms like fever, unexplained weight loss, or fatigue, it's essential to report this to your doctor. Don't simply endure it. It could be an important clue your body is providing about an underlying issue that needs investigation. Fourth, unexplained weight loss, often first noticed in the morning. Perhaps you wake up, get dressed, and notice your clothes feel significantly looser than they used to. Or you step on the scale first thing in the morning before eating or drinking and see the number consistently dropping week after week, even though you haven't changed your diet or increased your physical activity. While many people wish for effortless weight loss, unintentional and unexplained weight loss is a serious medical red flag, particularly in older adults. Significant unexplained weight loss is defined medically as losing more than 5% of your body weight over a period of 6 to 12 months without trying. However, with certain cancers, this loss can be more rapid. This symptom, often first apparent in the morning before daily fluctuations occur, can be one of the earliest signs of several types of cancer. Cancers of the digestive tract, such as pancreatic, stomach, esophageal, or colon cancer, frequently cause weight loss. This can happen because the cancer interferes with the body's ability to absorb nutrients. Malabsorption increases the body's metabolic rate, burning calories faster, suppresses appetite, or causes nausea or difficulty swallowing, leading to reduced food intake. Pancreatic cancer, in particular, is strongly associated with unexplained weight loss because the pancreas produces enzymes crucial for digestion. A tumor can block these enzymes or disrupt nutrient absorption. Other cancers, like lung cancer, lymphoma, and advanced cancers of any type, can also cause weight loss. This often occurs because the cancer cells consume a large amount of the body's energy. Additionally, cancers can release cytokines, inflammatory substances that alter metabolism, If you notice you are losing weight without explanation, especially if it's a consistent trend observed on the morning scale or through looser clothing, track it carefully. Note the amount lost and the time frame. This is not a symptom to ignore or celebrate. It requires prompt medical evaluation to determine the underlying cause. Let's quickly recap the 4 key morning signs we've discussed that warrant medical attention. A persistent cough or hoarseness upon waking that doesn't resolve. Profound morning fatigue that persists despite adequate rest. Regular, drenching morning or night sweats without an obvious cause. Unexplained weight loss, often noticed first thing in the morning. It is vital to understand that experiencing one or more of these symptoms does not automatically mean you have cancer. Many other less serious conditions can cause similar signs. However, these symptoms are significant red flags that should never be ignored or automatically dismissed as just part of getting older. They signal that something in your body has changed and needs professional evaluation. Early detection is arguably the most critical factor in successfully treating many types of cancer. When found early, treatment options are often more numerous, less aggressive, and lead to better long-term outcomes and survival rates. Your body is incredibly adept at signaling when something is wrong. These morning signs can be its earliest whispers, occurring before more obvious or debilitating. Maintain regular checkups with your doctor, but also be your own health advocate between visits. If you are experiencing any of the symptoms discussed today persistently, please schedule an appointment with your healthcare provider. Explain your symptoms clearly, including when they started, how often they occur, and any other changes you've noticed. They can perform the necessary examinations and tests to reach an accurate diagnosis and guide you toward appropriate action. Your health is your most valuable asset. Investing time and attention in understanding your body's signals is crucial. Don't wait for symptoms to become severe. Thank you for joining me today. I hope this information empowers you to be more attuned to your body's messages. Please share in the comments below one thing you learned today or a question you might have. Your engagement helps us understand what information is most valuable to you. If you found this video helpful and informative, please give it a thumbs up, subscribe to the channel if you haven't already, and share it with friends, family, or anyone you know who might benefit from this knowledge, especially those in the 60+ age group. Your support allows us to continue providing important health information. Remember, your body often communicates in subtle ways. Pay attention to those morning whispers. Early awareness and action can make all the difference. Take care of yourselves, be proactive, and consult your doctor with any concerns. Thank you for watching.